we recognize that it's not just going to be Democrats doing it. We're going to need bipartisan support. Now, exactly. Now, here's the thing, okay, is that a lot of these social conservatives also happen to be economic conservatives. And they see this, and this is from people I've talked to, people that wanted me to bring this up talking to you. They see a lot of this as just another bureaucracy. They see it as just another reason to take more taxes, to get more of this stuff done. How do you respond when talking to people? Have you had people bring that up?
Yeah, absolutely we have. But I think when you're talking about protecting a life, the life of an unborn child, when you're fighting to overturn Roe v. Wade, when you're saying that these women should carry the babies to term, the number one problem they have is financial issues. They're concerned about how they're going to raise the child, and they may not have health insurance. And so these are really issues that we need to address. And if you're serious about ending abortion in America, we have to provide women with more support. And if you're not willing to do that, then we're not going to lower the abortion rate, and we're not going to end abortion without making sure that the women who are in crisis or unplanned pregnancies have the support they need to carry the pregnancies to term and know that they have somewhere to turn.
Now, when I talk to pro-life individuals on the conservative side of things, on the Republican conservative side of things, there's this general misunderstanding, in my opinion, a misunderstanding of women who go and get abortions. And it's almost, it was typified really in my comment section on YouTube when I dealt with a pro-life video just recently, and a guy sat there and said that these fornicators don't want to have a child, and so now we have to pay not only for their fornication, we have to pay this. Now, you mentioned that the number one cause of this is an economic factor. That these aren't just women foaming at the mouth waiting to murder children, that these are real-life people with real-life struggles who go through this. Now, what kind of research have you done, and could you encourage people to do that really gives them a better idea, a better understanding of why women do what they do when they go in to get an abortion?
Right, there's been quite a few studies on this, and when we were putting this 9510 initiative together, we talked to people all around the country, and we looked at different states, and we said, what kind of things work to help reduce the abortion rate? And one of the states we looked at was Michigan, because they had a really big drop one year. It was an 11% drop in the abortion rate, and what that stemmed from was an advertising campaign, a public awareness campaign to let women know where they could go to get help. If they were experiencing unplanned pregnancy, direct them in a place that will help them and say where you can get WIC funding, where you can get job training, where you can get child care, if you need legal assistance. So sort of this, so when they were in this situation and they had no one to turn to, if they went to either a pregnancy center or some place to get support, and they realized that they weren't alone in this. Even if the boyfriend or whoever left the picture, there was still somebody there that was going to help them and help them through this, and even on afterwards. So that's part of the 9510. Also, healthcare is an issue. Healthcare was considered a pre-existing condition in some cases still. A lot of people thought that loophole was closed, but it's not. So if you become pregnant and you don't have health insurance, you look at it could be $20,000, $25,000 to have a baby, and it's $300 or $400 for an abortion. If you're looking at weighing those costs, if you don't have health insurance and don't have a lot of money, you're kind of pushed in one direction. So there's that banning discrimination against pregnant women is in the 9510.
Now you're mentioning the 9510. And, that was what brought this up, and I did a real injustice to those listening, okay? And that was this. Mark it up as a rookie mistake. Explain to us, briefly, what the 9510 is.
Right, the 9510 initiative is a goal to reduce the abortion rate by 95% in 10 years. And a lot of people ask, well, why did you pick 95? And I think why we said 95 is because 5% of abortions are attributed to rape, incest, or life of the mother. And so we figured, those were going to be the hardest ones to address. The other 95% would be a little bit easier to address because a lot of even pro-life individuals are not opposed to abortion in those cases, those high exceptions. So this 95% it includes support for pregnant women, which is the Pregnant Women Support Act, which we're really pushing in Congress. But we also parental notification is part of the 9510 as well. A study came out recently that showed that with parents' involvement, the abortion rate can go down between 13 and 31%, depending on whether there's two parents involved. And also, prevention. Prevention has to be part of it too. Obviously, if we're going to prevent abortions, we should try to prevent pregnancies as well. So, that's part of how we're going to reduce the abortion rate by 95%.
Yeah. Now, with the economic crunch we've got going, right, we're in some seriously dire times. Mm-hmm. And with this being as it is, there are a lot of individuals I've talked to that said, well, where is this money going to come from? Where is the funding for this going to come from? And one individual specifically brought up something rather interesting. And his question was whether or not some of these things may already be in place but aren't being enforced. And he said, ask Kristen, ask Mrs. Day. Are you Mrs. or Miss?
I'm Mrs.
Mrs. Okay, ask Mrs. Day if they've looked into whether or not there are already laws on the books and already people, that are supposed to be doing this, but it's not being enforced, or if this is an entirely different package that's not currently on the books that needs to be added, and where the money could come from. Could certain programs be cut? And if so, what programs do you think could or should be cut and money dispensed towards this?
Well, I do think once we get out of Iraq, we'll have an extra $10 billion a month.
Yeah.
So maybe we can put that money toward helping pregnant women, and I think we would have a big successes right away. But in some states they are already doing some of these things. So a lot of this would be federal money, grant money to help the states, other states implement it. One of the things that are part of it is the SCHIP program to cover pregnant women and their unborn children under the SCHIP program. And there are several states that are already doing that. So this would be sort of an incentive for more states. I think there are about 13 states that are now covering unborn children under the SCHIP, which is the Health Care for Children program. So more incentive to try to. And I also think that part of it is awareness. And really, I think the public awareness campaign would be a huge help to pregnant women, letting them know where they can go. Even with the safe haven laws, we just had another woman leave her baby in a park, I think it was, and the baby died because when she probably didn't know that she could have left the baby at a hospital with no questions asked. So I just think there's a lot of information that we can get out there to these women. I think. In my opinion, if you're pro-life and you want to end abortion, this is the only way we're going to do it. But on that note, when we put this together, we did consult with Republicans, mainly Congressman Chris Smith from New Jersey, who's the co-chair of the pro-life caucus. And to have his support on this was, I think, paramount to the success of passing this legislation. So we do have bipartisan support for the bill. We have pro-life and pro-choice people on the bill. So we really wanted something that was going to get broad-based support because it is. One party cannot do this alone.